I love curious patients, the ones who ask questions because they truly want to understand what the dentist is doing in the mouth. And here is a question I'm often asked. Is it better to keep my natural tooth or is an implant better? I believe that knowing this is first of all your right and secondly your responsibility. You need to understand what is being done in your mouth because it's yours and it's a part of your body. So let me explain it to you. A natural tooth, if it is healthy or can be saved, is almost always the best choice. An implant is an excellent solution when properly indicated, when the tooth you might want to keep is too damaged, but it remains a replacement. I personally have an implant and a couple of crowns on root-treated teeth, and honestly, I don't notice any difference. However, the first goal is always to preserve what is natural or to restore if it's possible. Only when the outcome becomes too uncertain do we extract the tooth and replace it either with an implant or sometimes with a bridge supported by natural teeth. Let me explain it with a drawing and an X-ray. As I told you before, natural teeth have their periodontal ligament and elastic structure that absorbs forces and impacts. They function at their best because of this. In cases like these patients, where the roots were severely compromised, they had to be extracted. These roots couldn't be used to support a bridge, so they were removed and replaced with 2 implants. On these implants, we built 3 or 4 teeth bridge on implants. These teeth look and function like natural ones, but they are fixed onto implants. The result is very similar. Just like in my case, I have an implant and I don't even notice it, but still natural teeth are always better. Here is a sequence of X-rays showing my lower left second premolar, the 5th tooth on the left. It was extracted because it was causing pain, treated outside the mouth, and then reimplanted. After a few months, you can see how the 2 molars moved closer together and the pocket reduced. After 13 years, the space between the molars remains healthy and stable. However, the reimplanted tooth began to show signs of internal resorption. You can see the dark area in the center of the root. Over time, the tooth weakened and eventually failed. Here you can see the remaining root during the extraction. And this is my new tooth, an artificial root, an implant with a new crown. This happened 17 years after the reimplantation. An implant is not better than a natural tooth. It is an artificial root on which a fixed prosthesis, a single tooth or a bridge is placed. A natural tooth has a periodontal ligament, blood supply, proprioception. It senses pressure, adapts, interacts with the bone. It is yours, it's a part of you. An implant is a titanium screw integrated into the bone. It works very well, thankfully, but it does not have biological sensitivity. When a tooth can be saved, keeping it is almost always the most conservative choice, especially if it is healthy. Implants are an extraordinary solution when teeth are missing or cannot be saved, but replacing healthy natural teeth with implants is not progress, it's a biological loss. In the next video, we'll look at what happens to the bone when a tooth is lost and not replaced.